ACIP committee examines COVID booster shots with a narrow focus. According to Reuters Health, the Advisory Committee on Immunization Practices, or ACIP, will present its recommendations to the CDC regarding COVID booster shots in June. This was initially scheduled for February, but the meeting was unexpectedly delayed just days after Robert F. Kennedy Jr. assumed the role of head of the U.S. Department of Health and Human Services. The CDC, which operates under HHS, stated that the postponement was to allow for public comment. At the June meeting, the ACIP committee will deliberate on recommending the updated vaccine or booster exclusively for vulnerable populations at risk of severe COVID-19 for the 2025 to 2026 season. According to the CDC, these vulnerable populations include the elderly and people who are immunocompromised. However, these groups are also the most likely to experience severe adverse reactions, including death, due to overloading their already weakened immune systems with an injected challenge. What should be done is helping these groups get stronger through lifestyle and diet changes, not weakening them by further challenging their immune systems. But the ACIP committee doesn't see it that way. The prevailing belief is that higher serum antibody levels equate to better protection. However, protection doesn't come from serum antibodies alone. They acknowledge that serum antibodies can't prevent infection. They only respond once infection occurs. Consequently, the focus shifted from preventing infection and transmission to mitigating severe disease symptoms. The issue with this approach is that the injections produce serum antibodies targeting a protein that mutates, rendering the antibodies less effective. These suboptimal antibodies may bind to antigens during subsequent infections in a way that prompts immune cells to replicate them instead of eliminating them. This phenomenon is known as antibody-dependent enhancement of infection. Suboptimal antibodies can also trigger the immune system to activate the complement cascade, a highly inflammatory process that can cause significant tissue damage. This is referred to as antibody-dependent enhancement of disease. Both of these paradoxical issues are driven by suboptimal antibodies produced by the injections, hence the term ADE. The narrative continues with a statement from ACIP panel member Denise Jameson, claiming that COVID remains a leading cause of death among both adults and children. This assertion is misleading and appears to be a tactic to justify keeping the COVID shot on the childhood immunization schedule. According to the CDC's own data, in 2023, COVID-19 has significantly declined as a leading cause of death in the United States. Despite this, the agency currently recommends that individuals aged 6 months and older receive an updated COVID-19 vaccine, regardless of previous vaccinations. Additionally, another panelist, Jamie Lower, mentioned, "Even though I'm very much in favor of considering a risk-based approach, I am concerned about the feasibility of it and the message it might be sending. The message it might send is vaccine hesitancy, something they are keen to avoid as it could challenge the current vaccine policies." Their narrow perspective prevents them from recognizing that the most effective boosts to our immune systems come from natural exposures. These exposures occur constantly, just like the ocean tides. Masks, social distancing, and isolation cannot prevent them. Natural exposures help build mucosal immunity on the epithelial barrier, including tissue-resident cytotoxic T cells that can prevent future infections. In contrast, injecting foreign proteins or the instructions to produce them distracts the immune system, focusing it on the injected material rather than natural exposures. As a result, illness persists in the vaccinated population. By halting the injections, we allow natural protective mechanisms to rebuild, even in those who are vaccinated. We then face the challenge of managing symptoms in those with persistent protein production from the modified mRNA injections, and finding ways to stop it before it becomes fatal. As always, thanks for watching and thanks for staying smart.